subjects. We have various clinical subjects. As you all know, we initially start our MBBS with the first year subjects where we learn about how the body works. We learn about anatomy, the physiology, and we also go into depth of the cell, which is nothing but the biochemistry. We learn about the biochemical reactions. Then we go into the second year where we learn how the body can get deranged, how the body can be affected by diseases, which we learn in pathology, which we learn in microbiology, and what are the drugs we have to treat them in pharmacology. Then we take a slight detour in third year where we learn about PSM, FMT, ENT, and ophthalm. But now in our final year, we have subjects which are clinical oriented. These are the actual clinical subjects which require you to understand, which will enable you to interact with the patients, which will enable you to actually become the doctors. This is the final step into becoming a doctor, isn't it? This is your final year. So these subjects will be clinically oriented. These subjects will be talking about the clinical features, the symptoms, the signs a patient comes to you with, and what are the investigations you have to order to diagnose, to come to a final diagnosis, to come to a final conclusion. And then finally, you will be going to the treatment part. So with that, I think I can now hand over to the first speaker of the day, which is Dr. Tahura, who is now an intern, a house surgeon in Dr. VRK's Women Medical College. Dr. Tahura, over to you. I think you can start talking about general medicine now.
Thank you, Zan, for introducing me. Assalamu alaikum wa rahmatullahi wa barakatuhu. I'll be sharing with you all few tips on how to tackle medicine for final year. Medicine is one of the vast and major subjects of MBBS curriculum. The scope of knowledge in medicine is endless. Like there's no limit to it. If you study even Davidson page to page, there will be something left out which will be given in Harrison. So, how to go about it then? First of all, you will be time bound. You have to be prepared to write your professional exams in a span of 9 to 10 months. Keeping in mind the schedule of KNRHS, you have got 7 months for exams from now on. So what you can do is, you can divide your time period on a ratio of first 4 months and the last 3 months. Why so? Because both gaining knowledge of the subject and passing the theory exam is equally important for us. Basically, you'll use the first 4 months to get knowledge of the subject with all the best possible efforts. And in the last 3 months, you can just stick to the Q&A pattern of learning, previous year questions, and using the last minute resources like JTM notes, smart notes. Basically, the whole memorizing part towards the end of your preparation in the last 3 months. Now, what you will do in first 4 months is, you will invest your time in gaining knowledge of the subject by watching videos, then revising the app notes multiple times, and then selective reading of the textbooks for only the important questions that are mostly given in past 20 years questions, only those. And if time permits, you can solve some MCQs from the app. This way, your PG preparation will also be aligned in a proper manner. Now, coming to video resources, you can use any platform of your choice. Just keep in mind, you have to finish listening to the lectures at least once so that you are aware of the subject and terminologies used there in each subject. Mind you, don't get stuck in a video if you feel like it's lengthy, you're not able to proceed further, just skip it and proceed with the next video. Because skipping a video is less harmful than not completing major chunk of the subject. Similarly, you can skip few unimportant topics videos similarly. Coming to notes, you can use printed notes and revise them repeatedly. Since final year is a very hectic year, you can't make your own notes while watching the videos. So I suggest, at least for the final year subjects, use the printed notes. Coming to the textbooks, see, you have already watched the videos, you have already revised the app notes. Now you're using textbooks only for taking the key points which you have to present in theory answer. So you will do a selective textbook reading here, like I already mentioned, only for the previous year important questions. That way, your theory answer will be in a presentable manner. Coming to the choice of textbook, you can choose any textbook of your choice, be it Davidson, Archit Bolar, or Mantapa, because they all have their own pros and cons. So it's basically your call to decide based on your preferences, based on your study patterns and preferences. I'd personally suggest you supplement your app notes with tables from Davidson so that you know the subject from your app notes and you include the tables of clinical features and management part given in Davidson simultaneously. Because this way you'll have a knowledge from Davidson, which is a like widely used regimens mentioned. So that will keep you in a very good position. You'll write down the regimens which are given in the standard textbook. So examiners will also be able to identify that like this guy or girl has written from the standard textbook. You did not necessarily study everything page to page in any of the textbook, but see that you read at least the important questions from the textbook. And coming to the what topics or chapters to complete first, I'd say in medicine, respiratory medicine has got a major scope this time. Respiratory medicine, rheumatology, psyche, derma, they've got a very good weightage in theory papers, and they're also very short and interesting topics to start with. I'd personally suggest you to start with these topics and later shift on to major topics like CNS, CVS as time goes. Coming to the practical part, you can use any practical manual of your choice, be it Alagappan or Hutchinson or Archit Bulur. What matters is the subject. First of all, you get your basics strong in like history taking and all the terminologies, the basic stuff. Then you study system-wise examinations, like how to examine a particular system. Because this systemic examination will help you in all other subjects as well, including pediatrics. You can watch YouTube videos or any app videos for a greater understanding of the clinical examination. Make sure you utilize your time in clinical postings and study the practical part there itself, so that it doesn't become a burden for you to read alongside the theory matter. To conclude with, medicine is as vast as an ocean, so make sure you know something of everything. See, medicine is not a very new subject to us. We have been studying it from the first year of physiology till the very recent third year. What you have to do is you have to go back to your respective years and revise the topics or chapters which you have already studied there. For example, you have to revise pathology for you can complete hematology from same patho textbook. Similarly, you can do infections from microbiology, and also you can do poisoning from forensic medicine. This way, you'll be able to read it faster. So actually, you will be revising that subject, right? You've already gone through the textbook. Your highlightings and all will be there. You're just revising it once more, and for the sake of medicine, it will be easy, inshallah, if you all plan and start early. This is all from my side. Wishing you all the best. I'll take the queries towards the end.
Jazakallah khair, Dr. Tahura. Those were really good insights into general medicine. This is a very vast subject, but if you actually approach it well, you will find it that it is one of the easiest and logical subjects ever. So let's move on to general surgery. So general surgery is actually the second longest subject in final year. Right in the beginning, like this is one of the most popular clinical subjects as well, along with general medicine. Like when you initially join MBBS, all of you might be thinking that you want to be either a cardiologist or a neurologist or a cardiothoracic surgeon or a neurosurgeon. Very few of you might be thinking you want to do pediatrics or you want to do dermatology or radiology in the beginning of your MBBS. So this being the most popular clinical subject. It is also a tougher one. Can we move on to the next slide? We'll talk about theory syllabus. Yeah. So general surgery actually constitutes about the actual general surgery part, which constitutes how the body responds to an injury, what is shock, what is wound healing, what are the various surgical infections, what are the various swellings and ulcers which the patients come with. It also deals with basic surgical skills, trauma, and other parts, usually smaller regions of the body like the salivary glands, let's say, or vascular surgery. And all these topics, the general surgery topics, come in your paper 1 of university exams. Whereas in paper 2, you have the more interesting part, which is the systemic surgery, which deals about thyroid surgery, breast surgery, and abdominal surgeries, urology, etc. So and that is about 50 marks. The remaining 50 marks are of orthopedics, which actually now has been changed. Earlier, it used to be in paper 1, but from our batch, that is 2K19, it is in paper 2. So it actually constitutes a big weightage, which we will be talking about later. For now, we will be talking about general surgery. So general surgery, can we move on to the next slide? Yeah. So first, coming to the books, in general surgery, we have various books, Bailey and Love being the standard one. And we also have Indian books like SRB, Manipal Manual, Arif Naseem, and we have some exam-oriented books like JTM Notes, Smart Notes, etc. What you can do is, first you have to select a textbook of your liking. Let's say Bailey and Love. You have selected Bailey and Love. Then you can supplement it with a PG platform of your choice. Let's say Bhatia. In Bhatia, general surgery is taken by Jay Arora sir. So you first watch a lecture from Bhatia, then you go on to the textbook, read it, make some notes, and then revise. That's the cycle which you have to repeat. But since there are many textbooks, not all of them, like some of them are having their own pros and cons, which we'll be discussing about. So first, coming to Bailey and Love, which is actually the standard, one of the most recommended books if you want to read surgery very in depth. So, but like all standard books, you might have read standard books or you might have come across them in your previous years. This book is just like any other standard book like Genong or Parsons for ophthalmology or Robbins, etc. The conceptual explanation is really good, but it is quite lengthy and the content is not given in points. So you'll have to struggle a bit to make notes sometimes, or you can use your PG platform notes, whichever you like. What I suggest you is that you read GIT, that is abdominal surgeries from Bailey must. As a must, you should read abdominal surgeries from Bailey and Love because abdominal surgery constitutes a very big part of paper 2 of your university exams, but not only for university exams, also for our PG, that is NEET PG exams. Abdominal surgery constitutes a big weightage. It constitutes topics like hernia, appendicitis, pancreatitis, pancreatic carcinoma, stomach carcinoma, etc. So what I suggest you all is that you read abdominal surgery, at least abdominal surgery from Bailey and Love. Next, coming to the Indian books, we have SRB Manual of Surgery. Now, this is the most popular Indian textbook for surgery in the market currently. Like they also advertise on them that they have sold so many lakhs of copies. But what I have found SRB is that it sometimes becomes too lengthy and sometimes it focuses more on the content part. Like it tries to increase the content, but compromises on the concepts a little bit. Also, it sometimes becomes tedious because there's a huge content. It is, if someone have read Furana for ophthalmology, you can see that it is similar to Furana. In that the content is too huge. What you can do about it is that you can read the general surgery part from it, which is the paper 1 part, which is usually less. And you have to highlight the points. So you have to filter the unnecessary stuff. And it is a good book for general surgery, but I wouldn't recommend it personally for systemic surgery. Coming to the next one, which is like an easier version of an Indian textbook, which is Manipal Manual of Surgery. This book is especially helpful if you're starting a little late in your final year, let's say 3 to 4 months before your final exams, when you have taken up surgery, then this is the book you have to go for. What I would recommend is that you can read the general surgery part from here, and also the endocrinology and breast surgery part are really good in it, along with urology as well. But I would suggest that even if you are reading Manipal Manual of Surgery from the beginning of your year, you have to read Bailey and Love for abdomen. Abdominal surgery has to be read from Bailey and Love. especially if you are a student who likes to read standard books, who wants to go to an extra length, you want to cover extra edge topics, then you have to read Bailey and Love. Otherwise, the next textbook I suggest is Manipal Manual of Surgery. I'm not a big fan of SRB Manual of Surgery, but Manipal Manual is one of my favorites because this is the book I have read for my final year exams. What you can do, this is about the textbooks, right? So in the next, we have the last minute study resources. These are nothing but, like, for example, if you have started just 1 month before your final exams, let's say after the pre-finals, so these are the notes which you can go for: Smart Notes, JTM notes. Even you can use Marrow notes as well for that. We have online resources which are nothing but your PG platforms. So we have Marrow, in which Dr. Rohan Khandelwal sir teaches surgery. E-Gurukul, we have Dr. Jay Arora sir. Prep Ladder, we have Dr. Pritesh sir. We also have the new players coming up like Cerebellum and PW Med. In Cerebellum, we have Dr. Amrit Nashta teaching it. And in PW Med, I have not much knowledge about it. But I've heard that PW Med also is becoming a new player in this game. What I would recommend you now is whatever platform you have chosen, some of you may already have chosen a platform, or some of you might be looking for it. So whatever platform you choose, stick to it. For example, if you have chosen Marrow to study surgery, stick to Marrow, complete all the lectures, and choose a textbook from the 3 which I have discussed about, like either Bailey and Love, SRB, or Manipal Manual of Surgery. Once you have watched a lecture from your Marrow, let's say, you go to the textbook and read the same topic. I would suggest that you read at least previous 20 years from the textbook, because nowadays they are giving MCQs also in the university exams. So they have a bigger scope to ask from. They have huge content to ask from. So it is better to do previous 20 years of questions rather than just classic previous 10 years, so that you can cover the MCQ part as well. With that, what you can do is you can start making notes. After you have prepared those notes, revise them, and before the final exam also, you stick to the notes part, because it becomes very difficult to study the textbooks just right like 1 day before the exams. Usually the first paper, which is general surgery paper 1, can be completed in about 5 days if you are watching Marrow and you are trying to read Manipal Manual of Surgery. You can complete the paper 1 topics in about a week. But paper 2, which constitutes about like abdomen, endocrine, breast surgery, this will take you time. So I suggest that you start first with systemic surgery part, preferably abdominal surgery, and then you can go to the general surgery part. Coming to the next aspect, that was all about the theory and some aspect about the PG preparation as well. But coming to the next part, which is the postings and your practicals. So we have only one practical manual for surgery, which is SDAS. This is the classic, the most recommended one. All of our seniors, the professors in the college, everyone have read this book. This is an age-old book, and also they have updated it nicely. And it is a very good book to learn about the clinical examinations. And usually surgery is unlike other subjects in that surgery has a very visual diagnosis. For example, if a patient has come to you with a thyroid swelling, you can easily see a swelling in the midline of the neck, and you can easily figure out that it can be a thyroid swelling. Or for example, if a patient has come with a lump abdomen, or if a patient has come with varicose veins, so it usually is a visual diagnosis. And what you have to do next is you have to do the clinical examination, elicit a few signs, and then confirm the diagnosis, which will be elaborately discussed in SDAS manual. You have certain long cases like thyroid swellings, carcinoma breast, inguinal hernia, varicose veins, and a certain short cases which are usually asked in the exam, which usually consist about a swelling and an ulcer. So you have swellings like sebaceous cyst, you have swellings, for example, like small umbilical hernia, a hydrocele, or you can have ulcers like arterial ulcer, venous ulcers, etc., which will be elaborately discussed in your postings as well. So what I recommend is that you don't just be a bystander in your postings. Try to attend those postings regularly. Be an active player in your unit. Try to take the cases, talk to the patients, and learn all about the clinical examination and stuff. What you can do to supplement SDAS is you can watch Ghanshyam Vaidya clinical examination videos on YouTube, or you can watch the White Army clinical case discussions on YouTube as well. So I think that's all with general surgery. We can go to the next subject, which is orthopedics. For orthopedics, we have Dr. Fatima Naeem, who's my colleague in Osmania Medical College. She's also a house surgeon who will be speaking to you about orthopedics. So over to you, Fatima. Dr. Fatima, are you there?
Am I audible
No,
now?
not at. Yes,
You are
now.
audible now.
Okay, sorry.
Yeah, you're audible.
My Bluetooth is acting up. 1 second.
Yeah, no issues.
Okay, right. I'm audible now, na?
Yeah, you are.
Yeah, okay. So, sorry. Assalamu alaikum, everyone. Hope sab khairiyat se hain. I'll speak about orthopedics, which is a pretty simple subject, but a large part of surgery. Can I get the previous slide? Yeah, okay. So, ortho has a huge weightage. It has 50 marks in theory out of the 200 of surgery and 50 marks in practicals out of the 200. So you can improve your surgery score that way. And even though it's an easy subject, it's a very volatile subject. So you might have to start preparing a little bit early. It will take less time only though. And in ortho, it's really important for you to get a clinical picture. There's a lot of fractures, and honestly, almost every single fracture is a long answer question in your university exams. So it'll be good if you get a clinical picture. So attend your postings. 2 weeks के postings रहते, at least try to attend 7 to 8 days and get a picture out of that. Can I get the next slide? Yeah. So your path in ortho is pretty simple, straightforward path है. एक ही online resource है जो almost सब लोग follow करते हैं. We consider it almost as a gold standard resource. Dr. Abbas Ali sir in Naro. So you have to listen to his lectures, and it'll take like 7 to 10 days. I think I would recommend you to listen of his lectures after completing medicine, surgery, and gynops, or somewhere in between during your clinical postings. It will not take much time, but after listening, you will have to revise once because it's a very volatile subject. Every single fracture has a name, every cast, every treatment has a name. So you might need to revise it at least once. At least try to revise of the major topics, like upper limb has around 2 to 3 videos. Lower limb has 2 to 3 videos. Revise those off. And in total, there are only 25 or 26 videos. So you can do it in very less time. After that, you have textbooks. The book most of us follow is Maheshwari and Maskar. It's a very simple book, easy to remember. Almost question answer format ke jaise hi rehta. Every chapter has like 1 or 2 LQs. Very simple. So we read that book after doing Maro. And Maro kar lene ke baad, it becomes even more simpler. Another option you have is Smart Notes or JTM Notes, but I would recommend read of Maheshwari because Smart Notes and Maheshwari are on the same level for a subject like orthopedics. In other subjects like surgery and medicine, Smart Note might be much easier for a last minute person who is trying to catch up. But in orthopedics, it's not much difference. It's a small subject, so you can finish it off. But yeah, attend your practical postings regularly because it helped me a lot personally because I had seen a few cases. So, in theory exam also, your practical knowledge will help because I'll tell you why. Every single fracture in ortho has specific displacements and angulations, like Colles fracture lelo. It will have a dorsal displacement, radial displacement, angulation, वगैरह. So to remember that, and there are multiple fractures which have similar displacements, you might get confused. So to remember that, you will need a clinical picture of a case that you had seen, which will make it much easier. So yeah, that's it about orthopedics. If you have any queries, I'll be here.
Thank you, Fatima. That was a good insight in orthopedics. Orthopedics, as she said, and as I already have said also in the previous one, that it constitutes a very big part of your surgery paper too, if you are good with, and it is one of the easiest subjects if you actually revise it. So it is a volatile subject, as she said. We all have faced that kind of a problem with it. And am I not audible? Can somebody respond, please?
Yes, you are audible.
Yeah. Okay. We just got a message that I'm not able to hear everything. I think, Rida, it can be a problem from your side as well. Please let us know if, okay, yeah, you are audible. Okay. So that's about medicine, surgery, and orthopedics. Like medicine and surgery, one of the bigger subjects, which constitutes ortho also. And you might be wondering, these people actually are talking about only medicine, surgery, vagara, vagara. Where are these radio, psychiatry, Where are these subjects? Where is anesthesia? Where is anesthesia? Where is psychiatry? Where is dermatology? So in medicine, you have dermatology and psychiatry included, whereas in surgery, in the orthopedic section, you have anesthesia and radiology. So these 4 subjects will be as a part of medicine and surgery only. And usually they constitute only about like 5 marks. They can come as a VSAQ or as a short answer, or you can get 1 or 2 MCQs from them. So coming on to obstetrics and gynecology. Obstetrics and gynecology is like one of the smoothest subjects. Okay, this is a really easy subject to go, especially if you are watching Marrow. So here, like मैं usually ये नहीं like कोई platform को ऐसे specific promote नहीं करता. I usually give a lot of options when I'm discussing about PG platforms. But obstetrics and gynecology, this one subject, I would recommend that you watch Marrow. You should watch Marrow. Try as much as you can to watch Marrow. It doesn't matter if you don't like, let's say, for example, if you don't like Sakshi ma'am's teaching, you can watch others, but to start with it at least, because this is one of the best, like the best place to learn obstetrics and gynecology. She covers the entire OBG in about like 110 videos, I think. But now in edition 8, she has promised that she'll reduce the duration of the videos. She'll reduce the number of videos. So this is one PG platform I would recommend for obstetrics and gynecology. I don't have any other experience with any other platforms. Sakshi ma'am is gold standard, like gold standard for OBG, as we have already displayed in the PPT that 90% of your work will be done. Moreover, like I would go further and say that 100% of your work will be done, because you will be easily, able to clear your university exams with Marrow notes of Dr. Sakshi ma'am. What you can do first is watch a video lecture from Marrow and then start reading a textbook of your liking. So we have like a separate textbook for obstetrics and separate textbook of gynecology. Can we move on to the next slide? Yeah, so this is the theory syllabus division. We have obstetrics in paper 1 and gynecology in paper 2. We move to the next slide, like in the books, yeah. Okay, so you have 2 books, popular books for obstetrics and 2 popular books for gynecology. We have DC Datta, which is like in India, it is one of the most followed books, and we have Mudaliar and Menon. Mudaliar and Menon is somewhat recommended over here in Telangana, I think, like because usually we have seen the YouTubers of the northern colleges talking about Datta, but Mudaliar is somewhat popular in the southern states. So Mudaliar and Menon Clinical Obstetrics is a comparatively easy to read textbooks. And if you have already watched Marrow, then reading Mudaliar will be a cakewalk for you, because almost everything from Mudaliar is covered in Marrow. But you will find that extra edge understanding, that conceptual understanding in Mudaliar, which will make you which will help you to understand the subject very easily. With that being said, we have 2 books for gynecology also. We have Shaw's textbook of gynecology and Essentials of Gynecology by Lakshmi Seshadri. Now, Lakshmi Seshadri is an author which is recommended personally by Dr. Sakshi ma'am, and that is why we have included it in this slide. It is relatively a new book, but it is quite simpler. It has beautiful diagrams, beautiful flowcharts, and it is recommended by the legend herself, Dr. Sakshi ma'am. So I think you can blindly go for it if you want a textbook. But otherwise, if you want to go slightly like a standard book, then you can go for Shaw's textbook of gynecology. But otherwise, I would say that even if you are sticking to only Marrow notes, let's say, then it will be more than enough for your university exams, for your PG exams, for your practicals and everything. Yeah. With that being said, that is all about the theory and the PG. We have certain last-minute study resources for this also, like Smart Notes, JTM Notes. We have Smart Notes available for all the subjects of MBBS. We have JTM Notes. We have Devesh textbook of OBG. And the online resources, like one of the most recommended is Dr. Sakshi Arora. But do not fall in a FOMO. Let's say if you have already started watching OBG lectures from Prep Ladder, let's say, by Dr. Prasan Vij, then continue with that. There is no harm in continuing with Dr. Prasan Vij's lectures, because I have a few friends who have watched him and they say that he also gives a really good understanding. But the one which we all have studied from, the one platform which we all have studied from is Marrow by Dr. Sakshi. We have a few certain practical manuals for the postings as well, like Sharmila Arun Babu and Hepzibah. But even the postings part, like the practicals part, is also discussed very elaborately in Marrow. So you can watch Marrow for that as well. Like in each topic, she discusses about the practicals aspect as well. In the final exam, in the practicals, you will have a one long case and one short case. Usually you have a long case from an obstetric part, and gynecology will be usually considered like a short case. So obstetrics, you'll have either a normal pregnancy or a previous LSCS or anemia, hypertension, gestational diabetes mellitus, or Rh negative pregnancy. Usually twin pregnancy, breech pregnancy are not given. And in gynecology, the most important topic, like in entire gynecology, is atypical uterine bleeding. If you do not know AUB in gynecology, then you do not know gynecology. It is as simple as that. And the others we have like DUB, which is nothing but dysfunctional uterine bleeding. It is almost the same as AUB with slight changes in definition, which you will come to know about when you watch Marrow, or if you are going to the postings and discussing these topics over there. You can also have a mass per abdomen. Mass per abdomen can be either a fibroid or an ovarian tumor. And lastly, you will have uterine prolapse. So these are the practical cases. So OBG is a very smooth subject. It goes like a story. So when you start with obstetrics, you will notice that it first starts with embryology, like right from the spermatogenesis and oogenesis part. Then it goes to the fertilization part, and then the embryogenesis, the development part. After that, you know that the pregnancy is divided into 3 trimesters now. The first 3 months, the second 3 months, and the third 3 months broadly. So you'll be discussing about each trimester in a sequence, and also you will be discussing things which come in a sequence. Like for example, what will be the challenges and what will be the problems which come in the first trimester, or in the second trimester, or in the third trimester, which we altogether like collectively call this as the antenatal care. So you'll be first learning about the antenatal care, then about the natal care, which is like the labor part, and then the postnatal care, which usually continues it in neonatology part of pediatrics, which will be coming about later. And in gynecology is also one of the easiest subjects. You have AUB, which constitutes the major part of it. Then you have disorders of menstruation, AUB. You have things like genital tuberculosis. You have various carcinomas like endometrial carcinoma, cervical carcinoma. And it is a very easy subject if you are following like Dr. Sakshi Arora ma'am from Marrow. Like everything is a cakewalk if you are doing that. With that, I think I can conclude OBG for now. I'll take your doubts at the end. Now coming to the pediatrics part. Pediatrics is like a short subject, just like ENT and Ophthal in your third year. Pediatrics is the same. It is a single paper subject. You have only one paper of 100 marks of theory and 100 marks of practicals. So what you can do with pediatrics is that you can read neonatology part and general pediatrics separately. So in neonatology, you have things like how the neonate, we deal with the neonatal care, which is nothing but the postnatal care after delivery, the first 1 month of life. So you'll be dealing about that. Along with it, we'll be discussing about things like growth and development, about the developmental milestones, and about various aspects. So this is the general pediatrics part. What you can do is you can divide your pediatrics into general pediatrics and systemic pediatrics. Systemic pediatrics deals with each system in detail, like for example, pediatric cardiology or pediatric neurology, let's say, or pediatric nephrology. What you can do is general pediatrics, you can read it during your initial first few days of your finals or at the end. But when you are reading medicine, let's say you are reading cardiology or cardiovascular system from medicine, you attach this pediatric part to it as well. So in a continuation, you watch a medicine lecture, let's say from any platform of your choice. For example, if you are watching Marrow, watch a Marrow lecture, see pediatrics, see the textbook for pediatric, the medicine part, complete the medicine part. And then at the same time, you go on to the pediatrics videos as well. Let's say you are watching Marrow, Dr. Singaram lectures from Marrow. You watch a lecture from pediatrics part of Marrow, you go to the textbook, and that will complete. So you have to read the systemic part of pediatrics with the systemic part of medicine. That is what I would recommend. So we have only 2 popular books in pediatrics. We have the standard book, which is Ghai. Reading the first 10 chapters of OP Ghai is mandatory. You will these first 10 chapters include things like growth and development, immunization, developmental milestones, neonatology part, etc. So reading these first 10 chapters of OP Ghai is mandatory for everyone. For the systemic part, you can either read Ghai or you can go to Arun Babu as well. Arun Babu is more of a exam-oriented book, just like Ramdas for pathology, if you remember, if some of you may have read that book. So just in a similar way that Ramdas gives a question and answer format for its text. Similarly, you have a question and answer pattern in Arun Babu as well. And it is like the best book for university exams. Many of my seniors have recommended it, and many of my colleagues also have read from Arun Babu and they got really good marks. Coming to the practicals aspect, pediatrics practicals is difficult because you have to examine the children. So children usually sometimes may not be cooperative, and you can find some difficulty in that. We have certain long cases like bronchopneumonia, pleural effusion. You have nephrotic syndrome, which is one of the commonest case which you'll get. You can have hepatosplenomegaly with jaundice, anemia, cerebral palsy as your cases. In your short case, usually you will have a neonatology case. So this will be either a term baby. A term baby means that this baby was born at the 9 months, right? 9 महीने के बाद जो बेबी होता है पूरे कंप्लीट 9 months कंप्लीट करने के बाद उसे हम हेल्थी टर्म कहते हैं. Healthy preterm will be somewhat the baby was born like 7 months or like 2 months premature. So you'll have a neonatal jaundice case also. You can also have a neonatal seizures case also. With that, you like the clinical pediatrics is really easy. The practical part, you can find it a little tough, but if you read it during your postings part thoroughly, you will find it easy. So I recommend a book called Clinical Pediatrics by Aruchami Lakshman Swami. This is a bigger book for this is like the standard book for practicals. But if you find some difficulty in reading Lakshman Swami, then the next book you can go to is Chadda. So Mayur Chadda is the book you can go for. I personally found Mayur Chadda to be easy, and I followed it for most of my practicals and postings. But I looked for certain parts in Lakshman Swami as well. So Lakshman Swami is like the standard book for practicals, whereas Mayur Chadda is a book you can go for if you want an easy to understand book. We also have another book which is Pediatrics Clinical Methods by Meherban Singh. Meherban Singh is like one of the oldest authors for practicals, but many of my colleagues and myself have find it a little difficult to read. We have found Mayur Chadda to be a lot easier. Usually people have a confusion between Mayur Chadda and Meherban Singh. Like for example, if nobody wants to read Lakshman Swami because it is a standard book, then the next options they have is Mayur Chadda or Meherban Singh. And many of my colleagues and I personally have found Mayur Chadda to be much easier and easy to grasp than Meherban Singh. In online resources, we have Dr. Singaram sir of Marrow. I think he is the one, just like we have Dr. Sakshi ma'am. We have Dr. Singaram sir in Marrow. He teaches pediatrics very elaborately, in a very detailed manner, which will help you not only in your PG exams, but also your university exams. Many of my colleagues have watched only Marrow and studied only Marrow lectures for pediatrics as well, and it has worked for them. So you can go for Marrow. But with that, you also have Meenakshi Bothra ma'am in Prep Ladder as well. So if you are a Prep Ladder subscriber, then Dr. Meenakshi is a really good professor. You can watch her video lectures as well. I think that's the end. Yeah, we have a dua to increase knowledge. We all need this. Rabbi zidni ilma. And yeah, that pretty much it is all about the 5 major subjects of your final year. All about medicine, surgery, OBG. I think we can have a small intro session now about IMSA, after which you can ask your doubts. Yeah, Dr. Farihal, please coordinate with Niraj for that. Like he wants to share his PPT about IMSA, and then we can see the doubts of the juniors, whatever they have to ask. I think we have pretty much covered everything. So let's see. Wa alaikum assalam wa rahmatullahi wa barakatuh. You can start, Miraj.
Hello, Assalamu alaikum. Is PPT visible and am I audible?
Yes, you are audible and we can see your PPT, Dr. Miraj.
Assalamu alaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. As I have myself, MD Mirajuddin from 2K19 batch, Spania Medical College, currently working as a house surgeon internship at Usmania Medical College. So, as I have given a small intro in the starting of this session. So, what is IMSA? You all might have known. It stands for Initiative of Medicos for Service and Academics, and basically it is a non-profit initiative taken by Medicos from all over Telangana state. And the aim is to create a unified platform for medical students working towards self-improvement as well as upliftment of the society, all under the guidance of Islam. So let us come to what is IMSA. So what is the purpose of IMSA or need for IMSA? So having known about the full form, now let us know with the sole purpose of to please Almighty Allah Subhanahu wa Taala, we felt the need to have a Muslim medicos community platform which can work on wide aspects ranging from academics, tarbiyat, personality development, and social service, all under the divine guidance of Islam, Sunnati Rasulullah. So basically, there is a need of a medical Muslim medical community platform which can work on a variety of aspects of academics, be it UG guidance, professional exams, or need PG guidance, or USMLE guidance, or USMLE PLAB or MRCP guidance, or IES if someone wants to become UPSC. So there are wide aspects that can be covered from academics. Then we come to Tarbiya, like personality development, characters. And then we have social service activities. So all these combined, we are trying to work as an organization. So let's embark on a journey to strengthen our iman, elevate our skills, and serve humanity with compassion. So, what are the aims and objectives of IMSA? So, basically, for now, you just have an idea. We are working toward our target is medical students, Muslim medical students. So, basically, it can cover, as already said, academics, personality development, and then, if possible, we can also do extracurricular, recreational activities, sports, and all those things. So, basic idea you get from this session, as there is a short of time. So, I'll be skipping all these things, but I will be sharing this PPT. We'll be sharing this PPT in the groups. You can go through that. Then social service, definitely social service is part of our organization, and as well as the Dini Talimiyat, which are inspiring us to do social service as per the Islamic principles. So then let us come to these. All these are the various aspects of activities that can be covered that are planned to be covered by IMSA. So now let us try to get some insights on the committees of IMSA. We have formed a few committees, 4 committees: committee on academics, committee on social service, committee on tarbiyah or personality development, and then we have a creative and designing team. So all these committees are formed for ease of organized work, ease of work by organized way. So we have committees. So let us go to committee on academics. So basically, when you hear the word academics, it will be definitely, it means it is something related to our professional course, that is MBBS, medical students. So basically, this Zoom session is also a part of academics committee initiative, and may Allah give Jazai to all the committee members who have worked as well as. So what are the potential projects that can be done in this through this committee under the academics committee 2024 to 25 term? So UG guidance for university exams, this session example, and we also have shared the PPTs for guidance, as well as now we are also doing the Zoom session. Then we have need PG resources or study groups. If you join IMSA, you will be added in those groups in which experienced and the people who have cleared the NEET PG exam with good ranks from our state and also different colleges, AIMS or various potential uh, in, uh, big colleges also. We have people across state and India as well. So you will be added in those groups, and Zoom sessions for NEET PG resources or online or offline events for NEET PG guidance as and when feasible we will be doing. Then we have IMSA USMLE community, especially for people who are aspiring for US medical licensing examination. So we also have a step 1, step 2 passed candidates who will be guiding you as aspirants. And once you also pass as a step 1, step 2 candidate, you will be connected to the US doctors, practicing doctors. We will be helping you connect with those people. And definitely networking is a very major part of the USMLE journey. So inshallah, we'll be helping in those things. And then we have separate groups for USMLE community also that I will be showing. So then we have lab or MRCP community at IMSA. In these also the similar way, if you are interested in that, you will be added in those groups, and you will be connected with the people who are experienced in who have experienced or cleared PLAB exam. At the same time, once you clear the PLAB exam, then you will be connected with the UK doctors, practicing doctors. Thereby, the further help you can take from that. Then we have interns and doctors community, especially targeting the interns, because as an intern, you will be facing a lot of issues like time issues. Even if you want to have analyze a case, you won't be having time, or even if you want to ask any PG, even those PGs or professors are so busy that you will be missing the clinical analysis part. So whenever you have doubts, you have to take photos, or you just keep an audio message in our USML intern doctors community group. So we have created a separate department-wise groups in which we have PGs and professors of respective departments who will be taking your queries and answering as and when feasible for them and convenience, as per the convenience. So basically, whenever as soon as you will join IMSA, you will be added in this IMSA general body group. We have different 4 committees you can join, and all these committees updates will be coming on their events every month. So whenever we are so organized that every first week of the month we will be releasing a monthly plan, in which monthly schedule, in which mostly 2 to 3 activities will be listed throughout the month on specified dates. So you can join those activities, and the updates will be given in the committees. And if you want to take the lead and become a project head or a volunteer, based on your choice, you can be participating in our activities. Then we also have the IMSA crack competitive exams community, in which we have a specific NEET PG specific group, USMLE specific group, and PLAB specific groups. There you will be added in once you join us. Then, as I have said, for interns, we have specific to interns and doctors community, in which doctors specific to the departments are already added. You can, if you are an intern, you will be added in this group, and it is exclusive. All these groups are exclusively for registered members of IMSA, and we have separate departments, as I have already mentioned. So now let's move to the next committee, committee on Tarbiyah. Definitely, Tarbiyah meaning everyone knows key something related to personality development, and all these things will be done with our some few of our projects, in which the target will be the personality development, Tarbiyah, and to become a better Muslim and a better doctor, and everything according to the Sunnat Rasulullah Sallallahu Alaihi Wasallam. So in these tarbiyat activities, you will also be exposed for skill building, ethics, leadership, skills. So then we have, what are the activities that can be potential activities that can be taken place by tarbiyat committee? You will be informed every monthly, whatever from this list, any one activity will be going on under the tarbiyat committee. Examples are online Quranic study circle we are planning. At the same time, offline one-day Talimo Tarbiyat program at Masjid gathering. So then we also can do online or offline Siratul Nabi program followed by quiz. And then offline personality development workshops can be done by inviting speakers like Munawar Zaman sir. And we also have a Telegram channel for daily habit monitoring. So habit monitoring के लिए we have a Telegram channel. Daily checklist will be put in the Telegram group. Once you register at IMSA, we'll be joining you in that group. And the checklist will be namaz, Quran, and academics like activities to monitor our activities. Then we come to the social service committee. And social service, the name itself is speaking a lot. As a medical student, the first thing we are taught is empathy, which forms the basis of this committee. Here we aim at enhancing the human well-being and alleviating poverty, oppression, and other forms of social injustice. Like basic idea is social service. The projects like this committee is trying to improve medical students' sense of responsibility as a humans towards humanity. So the activities that can be potential activities that can be listed in this term of 2024, 25. So the madrasa visit can be done, school visit can be planned to help encourage youth of community in mastering to master in modern fields of education, along with fostering of Islamic principles at individual as well as community levels. So this is what makes IMSA differ from other organizations, because it is we try to inculcate both the modern fields of education as well as the Islamic principles in the students. Then we have orphanage visit, old age home visit, blind school visit, donation drives, healthcare awareness talks, and medical health camp in collaborations with doctors. So these are the potential activities that can be listed for this stuff. So all the social service, we have to note one thing: all the ideology of the organizers or the leadership of the IMSA is that all the social service projects will be organized based on the teachings of Prophet Muhammad the only person we accept as our role model, and we try to inculcate all his teachings, and we try to practice those things, be it social service, academics, or Tarbiyah events. All this is a combination of the personality build-up as along with academic excellence. So, and all these social service projects will also be focused to make its impact long-lasting rather than just for publicity and simple satisfactions. So we do not do further. We are planning to make every project long lasting and beneficial to the human race. So then we have the last one, the creative and designing team, which definitely the name itself is speaking. If an organization is being run, if you're interested, you can join us in pamphlet making, poster making, or logos, or intros, creative writing, all those things will be included here. If you are interested, you can apply and you can join in this committee. So basically, all these committees are just to organize the work. It does not mean you have to be involving in organizational work. You will just be as soon as you will be joined. We will release monthly plan at in the first week. In the monthly plan, you will be listed. There will be listed 1-2 activities. In those activities, if the organizers are calling for opening call for project heads or volunteers, whichever positions or work you want to involve, you can just apply and actively involve in our activities. And definitely we'll be receiving certificates and all those things, electronic certificates. So next, the previous events of IMSA, you can view this slide. There are a lot of events we have done from 2020 till 2024. The latest one, Ramadan Quran Study Circle, Alhamdulillah. So I am not going through all these slides. You can go through. We will be sharing this with you. Madrasa visit, blanket donation, blind school visit, Ramadan ration kit distribution, and there were all these projects were conducted by various project heads across Telangana state from various colleges, different colleges, and volunteers were also have also participated from across states. So now some few might have doubts on what is the organization structure. I will be telling. So basically, for now, Telangana state is the main body for us. So we have president, 2 vice presidents, 1 male, female, 2 general secretaries, 1 male, female, 1 treasurer, and we also have a supervision body of senior doctors. So then we try to organize this work for the For that sec, we have committee in charges, committee on academics in charge, committee on tarbiyat in charge, committee on social service in charge. So, and creative and designing team also has one in charge. So this is the basic organization structure. Then we have the general body. So general body, you will be added in the general body. But slowly, we will also open calls for involving you in this main core team. This is the core team. So this in core team also, we want to join you based on your performance as well as the interview. That process will be you will be informed later. So even we also plan to expand this state leadership to the grassroots level at the district and college level. So that is also our plan based on the participation of the people we will be doing. So we plan to go district level. Example, if Mahbub Nagar is taken as a district, so Mahbub Nagar अक्रॉस 2-3 कॉलेज उसके आसपास 2-3 कॉलेजेस हैं उनको मिलाकर एक डिस्ट्रिक्ट माना जाए. So then district may we will have appoint one boy and girl district heads separately. Then for ease of implementation of the activities, we can also form committee in charges, district level committee in charges. Those will be connected to the state level committee in charges for ease of communication, and district heads will be connected to the president, vice president, secretary's office. At the same time, college level per be we can appoint batch heads or college heads, boys and girls separately. So we try to avoid intermingling of the genders, and okay, that is also a part. So basically now the question arises, what are the benefits of joining IMSA? So the summary of all these things, what I am speaking since 5 to 10 minutes, that IMSA aims to provide medical students a network to help in academics endeavors, be it NEET, UG, or next or USMLE or PLAB exams. You get a chance to build on your CV, a community to help you with your self-improvement journey backed by Islamic ways of life, a platform to own your team and leadership skills, exciting opportunities like interns and doctors group, US Family Community, PLAB or MRCP community, and general body, which has a social service, tarbiyat, and academics committee. So all these things you will be exposed to if you are joining us. And apart from this, social service is also a part of thing, and integrated work with other organizations. We are also planning to do that. So definitely doctors से भी communication रहेगा, even UGs, academic, be it academic, tarbiyat or Islamic. So social service activities. So how can the question arises how to join the organizations now? So you just need to fill the Google form. Link will be provided. Now the membership drive has not been opened. So inshallah, in 2 to 3 days, inshallah, we'll be sharing the links for Google Form. As soon as it includes the payment for lifetime membership fee. The fee is only utilized for organizational works. So soon after submission of the membership form, you'll be added in our official groups, whatever I have shown in the WhatsApp images. We have a general body group. Then we, based on your interest, we have a USMD or a NEET PG or PLAB groups, and we also have intern specific groups. Interns will be connected to the doctors. So these groups you will be added, and we have separate committee groups also. You will automatically be added if you are in the general body group. So soon after submission of the form, you will be added, and then you will be provided unique membership ID by us. And note that it may take 3 working days, 20 hours for whole process to complete, and you get added in the official IMSA group. So your patience is much appreciated. You might have a lot of queries for now. So inshallah, we will be sharing FAQ list in the chat as well as in the channel of IMSA. So yeah, most of your queries will be inshallah resolved by going through the FAQ list. You must also note that we will be providing e-certificates based on your level of participation and programs you will be participating as a volunteer or as a project head or as an organizer or as a committee in charge or district head. Every participation will be recognized, inshallah. And if you want appreciation letters at the end of your tenure of MBBS course, definitely you will be provided for CV building also. And You also, I would like to inform all the members that we also plan to have an annual state level felicitation program for IMSA members. Inshallah, a state level program will be planned, is also planned. So, with this, you can also go through this PPT. We have the present leadership at the end of the PPT. All these leadership, supervising body, in charges of committee, members of core team, so that you can go through once we end the because there is a short of time. So with this in the I would like to end in the halls of healing where humanity's spirit is reborn. Come join us, dear medicos, where compassion thrives and leaders are born. With stethoscope as our bands and kindness as dawn, together we sculpt stories of resilience weathering any storm. So now I would like to uh, let us pray. O Allah subhanahu wa ta'ala. Allahumma inni as'aluka ilman nafi'a wa rizqan tayyiba wa amran mutaqabbala. O Allah, I ask you for beneficial knowledge, goodly provisions, and acceptable deeds. For more queries, you can go through the FAQ link. We will be sharing that and or reach out to us at initiative@gmail.com. And I hope most of your queries will be answered in the FAQ list. How the core team has been appointed, what was the process of that, and what is a tenure of 1 year, and how you can be a project head, how you can join organization. All those things will be great. Jazakallah khair. Assalamu alaikum.
Walaikum salam, Miraj. Thank you for that wonderful introduction about IMSA, what it stands for, and what are the aims and objectives of IMSA. We would like all of the participants to invite you to join IMSA, to be a part of this organization. We want this organization to be like one of a kind, where it is a part of, like it is an organization by the students and for the students. With that, I think we can go to the doubts. So we have 2 doubts over here. Like, how should we schedule our subjects? Like, which subject should be more focused and which subject should be given less prevalence? So what you can do about this is, you now know that what are the lengthiest subjects of this final year. So you have medicine, you have surgery as the lengthiest subjects of final year. So you can start reading this first. At the same time, you can give some time to OBG and pediatrics as well. One of the best approach will be that whichever posting you are going through, let's say it is pediatrics posting for now. So you watch the lectures of pediatrics and you start reading pediatrics. The next month, if it is OBG, you read OBG. So you can club your postings with your theory schedule accordingly. So I think that would give you a more clarity, and you will be able to understand what you see in the postings as well. Now we got another question, that is it enough to do previous year questions till 2008 for university exams? Well, it's okay. You can, like, it's 15 years, right? 15 to 16 years questions. So yes, you can. Previous 20 years is like a broader term, I'd say, but yeah, you can go with through like 2008. That will be like 15, 16 years for university exams. It will be fine. I think so. It will be fine. And we have another question, that how we should balance to study from both online subscription and college schedules. So yeah, this is a problem which everyone face. How to go about an online subscription or a PG platform. Some may have taken an offline subscription as well, like they go to offline coaching. So that is like one of the biggest challenges every medico is facing nowadays, who is preparing for NEET PG or USMLE or any other what you can say, an entrance exam. So you have to plan, like plan not to waste your time. Let's say, like especially utilize your Sundays and your Saturdays, your weekends. Whenever and usually in your final year, usually the classes get cancelled. You have very few classes sometimes, like 1 or 2 classes per day. So try not to waste your time. What you can do is, whatever is being taught in the class, if you know it beforehand, try to watch a lecture of the same topic a day or like 2 before, so that you will be able to understand it more nicely in the class. Or what you can do is, if a topic, let's say anemia in pregnancy, has been taught today, so you can go back home, you can watch a lecture from Arrow of the same, like anemia in pregnancy, you can read the textbook, so it will consolidate your concepts much better. Do we have any other doubts? Please, I think you can ask your doubts now. Tahura, Fatima, and I are there. Even if you have any doubts about IMSA as well, Dr. Miraj will be there to clear your doubts about IMSA also.
This is a Q&A session going on. If you have any queries, please list in the chat box or you can unmute and ask.
Is it possible to manage all subjects in a week of time? Saif, like, are you talking about like before exams or you're talking about a general week? You can unmute yourself and ask your question as well. Okay, so a general week, how is it possible to manage all subjects? Well, it can be, like, for example, if you are going through, let's say, obstetrics and gynecology posting, so what you can do is you watch the lectures regarding the postings. You neglect the classes which are going on. You can go like for that particular subject for OBG, you can watch the lectures as per your posting schedule. For the remaining ones, you can watch as per your theory schedule. Like for example, this week hernia, varicose veins was taught to you in general surgery. In orthopedics, femoral fracture was taught to you. In medicine, let's say heart failure was taught to you. So you can go about them in the same way. But in OBG, let's say twin pregnancy, breech pregnancy was taught to you during your theory classes. But in postings, you are going to take a case of anemia and pregnancy the next day. So I would suggest that you go through anemia and pregnancy and you go through twin and breech pregnancy later on a later date. So that's how you can manage. Yes, it can be difficult. What you can do is you can divide the week. What I used to do, especially by the end of my year, is okay, I used to give the first 3 days to medicine, 2 days to surgery. The next 2 days I used to divide between OBG and pediatrics, because OBG and pediatrics are really small subjects. So what you can do is you can neglect the theory and the posting schedule like completely. You can make your own schedule if you want to. You can divide the days accordingly. Medicine, yes, it will take time. It will take 2 or 3 days of yours. So what I used to do is the first 3 days I used to give to medicine. Like I used to study only medicine during the first 3 days. That is Monday, Tuesday, and Wednesday. Thursday and Friday I used to do surgery, and then Saturday and Sunday I used to give time to OBG and pediatrics. How can we become a member of IMSA? A Google form will be circulated to you. I think Miraj has already spoken about this, and he will also be sharing his PPT so that you can go through that, and you can also ask your queries on the email which is provided, or you can contact, or a contact also has been provided. So you can ask your queries over there as well. A PPT will be shared to you, so you can go through that. Do we have any other doubts? You can unmute yourself and ask your questions also. It's not a problem. How to deal with internals if you are just clubbing posting subjects with the theory? And someone, I want to complete the major chapters of major subjects. Can tell me what are the major chapters? So your major chapters will be your previous 20-year questions, Saif. Like for example, like you're going about medicine. Let's say you have started cardiovascular system. Like everything is important because now you are entering into a clinical point of view. You like the patient will not come to you with only diseases from your previous 10 years, right? You cannot say to him, okay, I've skipped this part and I did not read about this. my fellow colleague has read about this, so you can go to him. No, like everything is important now. But in general, what you can do is you can go through previous 20 years of each chapter, the previous 20-year questions of each chapter through your textbook. But for PG preparation, what you can do is you have to follow the platform blindly. Like whatever they tell you to read and whatever they tell you that is important, you read that. And how to deal with internals. See, internals are something which are easy, which are about like what you can say, something which has been cleared in the theory only. So yes, you have a problem with the internals sometimes, but if your college people especially are strict about the internal marks, what you can do, you can, as I said, you can divide your general week into 3 parts. The first 3 days of medicine, the second 2 days of surgery, and the remaining 2 days of OBG and pediatrics. In that way, you will be able to read all the subjects in a week. So that is what you can do to tackle that problem. What I would suggest you is that you can divide your day also into 2. Like for example, if you have learned something in the postings, let's say you have examined a case of hernia today in your surgery postings, and in your theory classes, you have learned about, let's say, heart failure. So you come home and read both the topics. Try to read both the topics. But what I would suggest is that you do not ignore the posting wala schedule. अगर आप पोस्टिंग्स में हर्निया केस देख रहे हो तो पक्का घर को जाके वो आप हर्निया केस पढ़ो, या एक दिन पहले पढ़ लो या एक दिन बाद पढ़ो, बट उसी के आसपास पढ़ो ताकि वो जो आप विजुअल जो आपकी मेमोरी होती है वो बहुत स्ट्रांग हो जाती है. Shall we focus first on platform studying followed by solving MCQs? And at last, once of our exclusive, is my sequence right? See, platform studying followed by MCQs. See, MCQs is not something which you need right now. That is for the NEET PG, which you will be writing in between your internship or by the end of your internship. I would say that you focus on watching the video lectures, completing the video lectures, and going through the textbook rather than solving the MCQs right now. Yes, there is no harm in solving the MCQs, but if you are ditching the textbook completely, but if you are ditching like the university exams preparation completely and leaving it for the end, you will be in trouble, because university exams in the final year are not that easy. They are really tough, especially the medicine and surgery part. If I like be specific, then the paper 2 of medicine and surgery is really tough. So you have to read about, like you have to be concerned about the university exams also from the beginning of the year. Watching the video was this difficult. How should we manage that? Can anyone like Tahura or Fatima clear this doubt? Do you want to clear this doubt? Watching the videos of any platform once is fine, but it is very difficult to revise its notes. How should we manage that? Dr. Tahura, can you say something about this?
Yeah, I'd like to take that out. See, watching videos and getting knowledge of the subject is very essential part of your study right now. And after having the videos watched completely, you can revise the notes based on your important questions. Like what questions are being asked in your past 20 years question, you can revise the same part from the notes. There's no need of revising the app notes completely, because main videos are, elaborately given in any of the platforms. So you can cut down like that based on previous questions.
I'll add another thing to that. How I used to do it is, after finishing out the video, मेरी आवाज आ रही?
Yes, आ रही, बराबर आ रही.
Okay, all right. So how I used to do it is, videos we would finish off in the first few months, and then postings mein, especially I would tell about surgery. My surgery posting was in October, November, something like that. I completed all surgery cases. In the posting itself, while standing there, फोन में मारो के नोट्स खोल लेके ठहर जाते थे हम लोग, मेरे नंबर्स पूरे. और सुबह में पहले
फातिमा, आपकी वॉइस जो है थोड़ी सी रुक के आ रही, थोड़ा आवाज आपकी ब्रेक हो रही.
अभी आ रही?
हाँ, अभी अच्छी है.
ओके, अगर वो हो रही तो आप बोलो मेरे को. ओके, राइट. तो मेरे यूनिट मेंबर्स हम लोग कैसा करते थे बोले तो, सर्जरी में सुबह में जाके पोस्टिंग में मारो की वो टॉपिक खोल लेते थे. फॉर एग्जांपल वेरिकोस वेन्स थे उस दिन का केस, सो वी वुड ओपन दैट मारो के नोट्स एंड स्किम थ्रू द नोट्स वंस. लाइक सीप क्लासिफिकेशन रहता है वेरिकोस में, वो देख लेते, ट्रीटमेंट देख लेते, बेसिक पार्ट देख लेते, और कौन से वेन्स इन्वॉल्व रहते हैं, एनाटॉमिकल वो देख लेते, एंड देन 15-20 मिनट्स में हो जाता है. एंड देन वी विल स्टार्ट टेकिंग द केस ले लेते, उसके बाद डिपार्टमेंट को जाते, प्रेजेंट करते, फिर वहां पर बैठ के केस डिस्कशन होता था. सो इन दैट वे we would finish off revising Maro also. Maro या भाटिया नोट्स जो भी नोट्स आप फॉलो कर रहे हैं वो नोट्स के भी, और क्योंकि पोस्टिंग के जो केसेस रहते हैं क्लिनिकल केसेस जो रहते हैं वही मेजोरिटी एलएक्यूज रहते हैं आपके, नॉट ऑल एलएक्यूज बट बहुत सारे एलएक्यूज कवर हो जाते हैं इस वे में. So I think this is one way to revise your notes, because I know it's very difficult to revise notes after listening to them once. Motivation तो आती ही नहीं बिल्कुल भी. So posting में करने की कोशिश करो. 15-20 मिनट लगते हैं एक टॉपिक करने के लिए. That will be easy for you.
Right. और कुछ डाउट्स है किसी के भी? If we want to start about the NEET PG in final year, which subject should we start first? How should we complete in like how many weeks or days? फातिमा कुछ बोलना चाहेंगे इस बारे में? फातिमा
क्लिनिकल,
हाँ बोलिए.
आ रही है आवाज?
जी जी आ रही.
हाँ राइट, दैट विल डिपेंड आपके फर्स्ट सेकंड थर्ड ईयर के सब्जेक्ट्स कितने स्ट्रांग है. आप पहले वो बोला था, आई कैन गिव यू एन इनसाइट ऑन दैट, बिकॉज यू नीड योर सेकंड ईयर सब्जेक्ट्स टू बी स्ट्रांग टू start your proper NEET PG prep for medicine and surgery. फर्स्ट ईयर सब्जेक्ट्स फिर भी थोड़ा डिले कर सकते हैं आप, लेकिन सेकंड ईयर तो पक्का आपको होना पड़ता. फार्मा, पैथो, माइक्रो तीनों भी बहुत इंपॉर्टेंट है मेडिसिन सर्जरी के साथ प्रोसीड करने के लिए. सो डिपेंडिंग ऑन दैट आई कैन आंसर. If you have not done your second year subjects, तो पहले सेकंड ईयर के सब्जेक्ट्स थोड़ा बहुत रिवाइज कर लो. स्पेशली फार्मा रिवाइज करो. पैथो फिर भी मेडिसिन के कंटेंट में कवर हो जाता, लेकिन फार्मा आपको करना पड़ता अच्छे से रिवाइज पहले. उसके बाद स्टार्ट विथ मेडिसिन. दैट इज द मोस्ट वास्ट सब्जेक्ट. अंडरस्टैंडिंग में भी टाइम लगता, याद करने में भी टाइम लगता, रिटेन करने में भी टाइम लगता. एंड देयर इज अ लॉट ऑफ लॉजिक थियोरीज वगैरह मेडिसिन में, स्पेशली सीवीएस और रेस्पिरेटरी में है शायद थियोरीज बहुत सारे समझना पड़ता. सो स्टार्ट विथ मेडिसिन आई वुड से.
सेकेंड ईयर के सब्जेक्ट्स आपको डिटेल में नहीं करना है. ऐसी सेट कि भाई थोड़ा थोड़ा जो भी आप सपोज कोई एक पर्टिकुलर टॉपिक में वीक है तो उसको आप अच्छे से देख लीजिए. जैसे कि मैं थोड़ा सा जो है रेस्पिरेटरी फिजियोलॉजी में थोड़ा सा वीक था, तो बिफोर स्टार्टिंग रेस्पिरेटरी मेडिसिन आई वेंट थ्रू रेस्पिरेटरी फिजियोलॉजी वंस. उसके बाद मेरे को जो है रेस्पिरेटरी मेडिसिन थोड़ा सा बेटर हुआ. तो यू कैन डू दैट इफ यू वांट टू स्टार्ट अबाउट द नीट पीजी इन फाइनल ईयर. ये तो okay. Like NEET PG, if you're starting, it depends on like at what stage of your NEET PG preparation you are. Let's say if you're starting your NEET PG right now, like your preparation right now in your final year, then मैं suggest करूँगा कि you go through your final year subjects for like first. पहले आप मेडिसिन सर्जरी ये सब तो कवर कर लो. उसके साथ साथ जो है स्किन, एनेस्थीसिया, रेडियोलॉजी, साइकेट्री, ऑर्थोपेडिक्स, ये सारे सब्जेक्ट्स आप कंप्लीट करके उसके बाद आप फर्स्ट ईयर, सेकंड ईयर, थर्ड ईयर के सब्जेक्ट्स का सोचो. क्योंकि ये अपनी अर्जेंट नीड है. लाइक हमको फाइनल ईयर के सब्जेक्ट्स कंप्लीट करना है सो दैट वी कैन गिव आवर यूनिवर्सिटी एग्जाम्स, राइट. तो पहले आप ये सब्जेक्ट्स पे फोकस करो. एंड दीज लाइक यू विल हैव 19 सब्जेक्ट फॉर योर फाइनल योर नीट पीजी, जिसमें से मेजॉरिटी आपके देखा गया तो फाइनल ईयर के सब्जेक्ट्स ही है, राइट. आपके 9 सब्जेक्ट्स जो है फाइनल ईयर के है, whereas it is like 10 subjects of the like the previous 3 years. तो आपके 9 सब्जेक्ट्स कवर हो जाएंगे अगर आप सिर्फ फाइनल ईयर पे भी फोकस करते हो. देन you will be able to finish 9 subjects. उसके बाद आप ट्राई करो कोई जो है कोचिंग वगैरह में या जो भी आप ऐप यूज कर रहे हो. देन यू फॉलो दैट ड्यूरिंग योर इंटर्नशिप. यू टेक आउट टाइम to cover at least some of the subjects. But if you have already done, let's say, your second and third year subjects, then you will have only your first year subjects to complete, which you can take out time to do in your final year itself. Any more doubts, guys? You can also unmute. आप unmute करके भी पूछ सकते हैं.
Assalamualaikum. Someone asked about joining IMSA.
हाँ
तो
वो उसका
शायद चैट में शेयर कर दिए. मतलब still we did not start about membership drive. Once it is started, we'll be sharing Google Form links in all the groups.
Any more doubts, guys? I think हो गए जैसा दिख रहा doubts. We are here for. Okay, I think there are no more doubts. I think we can end the session. मेराज आप दुरूद बोलना चाहेंगे क्या एंड करने के लिए भी? दुरूद से या दुआ से एंड करना चाहेंगे आप? ओके ओके. So assalamu alaikum wa rahmatullahi wa barakatuh everyone. I'll end this session. Alhamdulillah, अच्छा वो आप लोगों के doubts clear करके. If you have any doubts, you can post in the Telegram group as well. We will try to clear it as fast as we can. Assalamu alaikum wa rahmatullahi wa barakatuh. We'll end the session now.